Hello, everyone. This is Dr. Nadal at Nature Cures Clinic over in Portland, Oregon. And here we have,
Dr. Ludenia.
excellent. So we are talking about some interesting, new, and exciting stuff that we'll be doing here at Nature Cures Clinic. It's ozone therapy. And this isn't something that everyone has heard of yet. It's very exciting and effective. And we're here just to talk about it, trying not to get too scientific, but enough to actually give you some good information and ideas as to how it works and who might be a good fit for it, right?
hmm
Great. So what is ozone?
Yeah. So ozone is naturally occurring out in nature in our environment. It's been used industrially for many years to help purify drinking water. It's been used as a disinfectant in pools and spas and even in some food processing plants. It's been used to treat different air quality and odor removal. It's been found that ozone disinfects 3,000 times faster than chlorine and is 1,000 times stronger than bleach.
1,000 times stronger.
Yeah, it's pretty heavy duty.
Yeah. And so so if we think of oxygen as like O2, ozone is O3. It's like a third oxygen molecule on it,
Exactly.
right? Okay.
Yeah.
And what are some of the medical uses of ozone?
Yeah. So medically, there are a variety of different healing benefits. Um, how we make it
Hmm.
is exactly like you were saying. There's two oxygen molecules, and then we run it through a little machine that has a little electrical charge, which kind of breaks the bonds apart. But then it allows for the three oxygens to bind together, and then this creates the O3 or the ozone, which is really unstable, but then it has the ability to bind to other molecules, which is why it's so useful medicinally.
Cool. So even though we hear the word unstable, that's the good thing about it, that it allows it to bind to other molecules.
Right.
All right. That's fascinating. And so we know that it is antimicrobial, which means antiviral, antifungal, and then it's a great antioxidant, right?
Yes.
Yeah. And the interesting thing is that it's also, ironically, an oxidant in some way. So it'll cause a little stress on the body, but with that, it's encouraging greater anti-inflammatory and immune modulating properties once it goes around the body, right?
100%. Yeah.
That's pretty cool. Do you know some of the history of ozone?
A little bit.
Okay.
It was used medically since the early 1900s. A little fun fact is actually in World War One, they would use it to treat gangrene.
Oh,
Yeah. And then it was used a lot in Europe and Cuba. In the US, it was suppressed some as kind of the US started to use more and more pharmaceuticals. But there's still a lot of research out there over the past 100 years because other countries continued to use it.
because it worked, right?
Yeah. Yeah.
Okay. So then clinically, why we would use it? I mean, so anti-inflammatory effects, right?
Yeah.
Its ability to increase circulation. And we know a lot from some of the neurodegenerative conditions that we work with, especially that's very important because many times there's some sort of inflammatory process happening in the body that's exacerbating symptoms. So not only it's helping with inflammation, but it's also helping to improve the blood flow, increasing oxygen delivery to the brain and helping to improve overall brain health and cognition, right?
Mhm. Yeah.
So then how do we get ozone into the body?
Okay, well, there's many ways to do this.
Okay.
You can do it topically with a salve or a cream and apply it directly onto the skin. There's different forms that a lot of dentists use, mouthwash, etc. There is a way to do a rectal insufflation, and
Hmm.
here ozone is put into a bag,
Hmm.
and then a small tube is inserted into the rectum, and then the ozone can be delivered, right into the colon from there. And because it's a gas, it can have direct access into the intestines and help with a numerous number of GI conditions.
Wow.
Yeah. And then likewise, the same can be done vaginally for a vaginal insufflation. And this is delivered in a similar way, and it can help kind of with persistent bacterial vaginosis, yeast infections, kind of some of those um, persistent infections. It can be applied inside the sinuses and in the ear canals because it has such a good antibacterial, antimicrobial component to it. Another interesting application is called limb bagging. And here essentially it's just a bag that is filled with the continuous ozone. And so your extremity goes directly into the bag. This is really useful for helping to heal wounds, especially like diabetic skin ulcers and kind of more stasis ulcers, because it helps kind of increase that circulation and healing.
That's awesome.
Yeah.
Okay. And it's not to say that we're going to be doing all of these quite different ways. You know, there's a lot of different like IV or joint procedures that we can include into it, right?
Absolutely.
Yeah. I mean, there's even ozone saunas, which are amazing for detoxing. And even with the joint injections, it helps to decrease inflammation within the joint. So it's great. It can be used alone or adding to any regenerative procedure like prolotherapy or PRP. And even through UBI and IV, there's a lot of therapeutic benefit there. So so then let's go a little further into that. What is the UV light application, or how do we connect that with the ozone?
Okay, so that we can use in combination. And the UVI is the ultraviolet blood irradiation. And so this exposes the blood to UV light through a little cuvette.
Okay.
Yeah. And this, again, like the ozone, has many benefits. It's germicidal, immune modulating. It helps decrease pain. It increases the ability of oxygenation to happen within the blood. There's just a lot of benefits from it.
That's amazing.
Yeah.
And we know some of the other interesting things is that we know it stimulates vasodilation, so improving microcirculation, right? And that'll help decrease the blood viscosity, or that thickness, right? So it'll help with better peripheral circulation, and again, improving oxygen supply, right? So we can see how very beneficial this is for cardiovascular, vascular health, and even nerve and brain health, right?
Yes.
And so are there different UV lights, like different types?
There are.
Okay.
3 of the main ones would be UVC, and each of the different lights kind of has a different job or a different effect. So the UVC is more germicidal, and so it kind of helps with the inactivation of the pathogens in the blood that are causing an immune response. The UVB is a little more focused on modulating some autoimmune responses. And then the UVA is also immune modulating, and it targets the regulating cells. And so this helps to restore the balance in the immune system.
Wow.
Yeah.
That sounds amazing. And I remember you said that you had some treatments done with this. Yeah?
I did this past last winter. I got sick, as many of us do in the winter time. And so I went in and had a few rounds, multiple treatments of the IV ozone. And it really made a big difference. At first I didn't really feel that great after my first session. And I was like, oh, I don't know if I should keep continuing. But then I'm like, I know it's so good for the immune system. And after like my second or third one, my recovery was so much faster. I had a couple friends who were also sick at the same time.
Amazing.
Who weren't, getting ozone. So
gave you that edge.
Yeah.
Okay. Yeah, and we know another way to deliver the ozone is through a process called EBOO. It's an acronym. So extracorporeal blood oxygenation and ozonation. All right, say that 3 times fast.
Yeah.
Right? So technically, I think this method uses a dialysis filter, right?
Mhm.
And this allows for a much larger amount of ozone to go through a larger surface area, about 2 liters of blood over 1 hour of time, which is huge.
Mhm.
And then, so one of our teachers were explaining that the EBU process is similar to making coffee, right?
Right.
Where you have the water that runs through and grinds the coffee filter is what allows the final product of coffee. And similarly, the filter with the EBU gives us the finished product by clearing or keeping grinds out of the blood,
Mhm.
if that makes sense, right?
Yeah.
So, what does an ozone IV treatment look like for a client? Like, how can they think about it?
Yeah. So first of all, they would come in, relax in the chair,
Hmm.
and then we take a little bit of blood and we put it into a bag. And then in that bag, we would inject some ozone. So the blood in the bag would then be mixed with the ozone.
Hmm.
And then we can administer the blood and the ozone mixture back into the body via an IV.
Great.
But the cool thing is, as the blood is going back into the body, it will pass through a little cuvette, a little light stick that is the UVI light. And so then we had previously talked about all those benefits. So not only is the blood getting ozonated, but then as it's returning back into their body, it's
Hmm.
passing through the UVI light.
That's awesome.
Yeah.
That's incredible. Okay.
Yeah. So who's not a good candidate for this? Is there anyone?
If we think about it, so surprisingly, there are very few times when ozone would not be used or beneficial. I think it's just good to be cautious with people with any type of thrombocytopenia or blood coagulation issues or active bleeding organs like ulcers, maybe the G6PD deficiency, which we know can come up, but even them we can consider doing ozone, but it just might have to be a lower concentration. Maybe a recent MI or uncontrolled hyperthyroidism or leukemias or pregnancy in the first trimester. But all those are not as common. That would be coming in here and requesting to get the ozone therapy. So, yeah, so many could benefit from it because studies are even showing that autoimmune issues were drastically reduced following a series of treatments.
Mhm.
Yeah. So, what would you say people feel like after?
Yeah, this is kind of variable, like with a lot of our modalities that we do, everyone kind of responds a little differently. So some people feel great right away after their first treatment, and other people don't feel so great. They may feel a little tired or fatigued, a little nauseous. Some people may experience some brain fog for a few treatments. And this is usually because it's a big detox for the body. They can sometimes have like a Herx like reaction, which is why it's so important to have some type of detox support on board.
Absolutely.
Yeah, and a little before, and then especially during and following the treatment to make sure that any toxins are cleared away and kind of reduce the or minimize the discomforts. But usually after about 3 to 4 treatments, if someone is not feeling great in the beginning, after a couple, they'll report feeling good. Usually increased energy, increased focus. Those are kind of the two kind of immediate ones that people will say.
Yeah.
Sometimes less pain, better sleep.
Wow.
It seems like there's a lot.
Yeah.
Yeah. So, and ozone is usually done in a series of treatments. It's not really just a one and done type of treatment. So the effects can kind of compound on each other.
Solid.
Yeah.
And
Yeah.
no, just so who should come in and see us? I mean, we know that it can treat over 130 different illnesses or conditions.
That's a lot.
Yeah. And the other incredible thing is that in cases where people have tried everything, ozone still has a 60 to 90% effectiveness when nothing else has worked.
That's
So,
crazy.
yeah, so the statistics are definitely in favor in its clinical application. So I mean, really, it's so, as we've said before, it starts with really just giving us a call, scheduling a consultation, seeing if you're a good fit. Let's just check in and see what's going on. And if ozone therapy could be a good fit for you, just, yeah, reach out to us. We're happy to chat and see if we can share this new and exciting therapy with you. All right. So this was Dr. Nadal.
Dr. Ludenia.
And until next time, if you have any questions or comments, feel free to just let us know. All right. See you next week.